Satyamon is my senior, and he has been interpreting for ARP since ARP started his service in Nepal. And he was very interested to go to school, but there wasn't any school in Nepal that could give him a credentials. Luckily, we came across a school, first ever acupuncture school in Nepal, and he was very interested to go to school and get the credentials.
So I'm going to Kathmandu school for the school. The name of the school is Rural Health Education and Service Center. It's for 3 years.
म डाक्टर मन्जुदा हाल हुँ र म अहिले यो रुरल हेल्थ एजुकेसन एन्ड सर्भिस सेन्टरमा एज ए डक्टर अफ अकुपन्चरको भ्यूले चाहिँ म यहाँ काम गरिरहेको छु। यो काम मैले गरेको धेरै वर्ष भइसक्यो, 20-22 वर्ष जति नै भइसक्यो र पहिला चाहिँ मैले एज ए डक्टरको रूपमा मात्रै काम गर्थेँ र भने अहिले चाहिँ आएर कलेजको प्रिन्सिपलको रूपमा म कार्यरत छु।
जुनसुकै रोगलाई चाहिँ अकुपन्चर प्लस एलोप्याथी जुन चाहिँ औषधि प्रयोग गर्दाखेरि मान्छे चाहिँ छिटो निभुन्ने चाहिँ कुरा मैले देखेँ हैन। अनि त्यस कारणले मैले यो विषयमा जनशक्ति किन उत्पादन गर्नु।
From the small childhood, I have aimed I want to be a doctor. When I finished my school level, after I had my SLC, see that it's admission open in the acupuncture school. And then after I give the exam, and I passed, and then I joined the college.
We have a 3-year course, and the first year is the basic science, and in the second year we learned about acupuncture, and then in third year we have to do totally practical.
The school as well as the students were a little bit confused how their future is going to look like.
Mostly they're trying to recruit students to be interested in a medicine that doesn't exist yet. And that's a very hard sell because people want to know where's the jobs.
Now also people are unknown about this field.
After we run for the first year and we had nothing to sell in the market. We don't know what to do, how to train our students. We had less number of faculties over here.
The schools was producing the manpower, but didn't know where they could get job. Whereas for Acupuncture Relief Project, they had already seen that we need the manpower in this sector.
Good Health Nepal came to contact with us, and Chering Sherpa, he came to us and asked us what you are doing over here and how you are running this program.
Like in the morning and
part of our initial mission is to just take students from the school out to the field. Show them what we do, show them how we take care of people, show them the effectiveness of medical model. Get them excited and interested in this kind of work. So that's what we've done this year is we've taken 12 students from the school. They work with us for about 10 weeks each, and mostly they work as our interpreters and they observe what we do, and then we do some training with them on a daily basis. And hopefully we send them back to school inspired to take their studies up a notch, come back and work with us again, come back and work with us as a resident. Because in the end, what we need is we need people that are interested in working in these rural environments.
To go to the village and to work with the village peoples, we can do a lot work on these fields.
Working along with the practitioners, they are trying to improve their skills, which they have learned theoretically, now they can see practically.
They are working there as interpreter. They are also at the same time what they are learning how to give treatment and all other aspects of their clinic.
The first day was really difficult because, well, we have learned English so far in the school very normally, but the practitioner English are very difficult to understand the terms. So first day was like hectic days. I feel like OMG, what is this? This is gonna be really difficult. But the second day, I feel like it's really interesting to work with them.
So now we have also put Dr. Andrew as our advisor. He's giving extra lecture hours to our students, and our students are also getting training from Acupuncture Relief Project.
How the doctors are, different doctors who comes from different countries, how do they work with the Nepali peoples? So I like to see that also, because different peoples have different techniques about doing the needles.
I'm learning about the new cases, like for example menstruation. We have not learned so much about the menstruation, and then after STI disease and degeneration of the disc And the people over here come much with the pain of backache and the knee joint pain. And about the knee joint pain, we have never learned in our classroom of medial collateral ligament. So I learned about the medial collateral ligament with the Dr. Jamal also. So it's really fun to study with them.
It's very special for us, and we are lucky we learn so many things from here. And if we are finished our study and well also, then we can do acupuncture.
Our students will have license to work because after they completed this course, they will have license from our Nepal Health Professional Council. So I hope clinics will run for 12 months by our students.
We are the future Nepali doctors, so I want to help much more people I can and serve them.